Well, you have to do your, yeah, now you have to do your clicker again. There we go. Okay, hypotension, bradycardia, and warm extremities, or flaccid paralysis and lack of sensation below the level of the injury. What is the description of spinal shock? I mean, what's that? They're in shock. The flaccid paralysis, remember we do have hypotension, we have bradycardia, but we don't have warm extremities, we have cold extremities, and we have flaccid paralysis and lack of sensation. Our IV orders are IV methylprednisolone, solumedrol, for the patient with a spinal cord injury at T10 level 3 hours ago. When evaluating the effectiveness of the medication, the nurse will assess blood pressure and heart rate, respiratory effort and O2 sat, motor and sensory function of the legs, bowel sounds, and abdominal distension. I love it. I love it. I love it. 26% want to assess blood pressure and heart rate. 35% respiratory and O2 sat. 30% motor and sensory function of the legs. 4% really didn't care, or 9% really didn't care much about bowel sounds. Okay. So what we have to look at on this particular question is what? What are the key words? No. When evaluating the effectiveness of this medication, those are the key words. When you see that, you ask yourself what? Why did we give this medication? Why did we give the solumedrol? The anti-inflammatory properties of reducing the swelling of the spinal cord, minimizing the deficits of the motor and sensory deficits that we would anticipate. So it's not going to affect the solumedrol, is not going to affect the blood pressure, the heart rate, the respiratory effort, or the O2 sat. So prioritizing based on ABCs, gotcha on that one. Evaluating effectiveness of the medication, very important phrase on an NCLEX question. In which order will the nurse perform the following actions when caring for a patient with possible cervical spinal cord trauma admitted to the ED? So this is not a clicker question where you have to tell me what we're going to do first. Immobilize the head, neck, and spine. Why are we going to do that first? Right, because if it's a cervical spine injury and we don't stabilize that spinal injury, what can happen? Yeah, we can do further damage. We can shut off their respirations, a lot of other problems. So first we're going to immobilize. Then what are you going to do? Administer oxygen. So immobilize first, then your ABCs. So administer oxygen, then what? Monitor cardiac rhythm and blood pressure, and then transfer for the x-rays. There's a reason why it's not on the test. The nurse notes that the older client has a hypoactive response to a test of deep tendon reflexes. The nurse incorporates which intervention into the plan of care? Assist with ambulation, elevate the lower extremities, elastic support hose, massaging the legs every 8 hours. Okay, 62% said assist with ambulation, 14 elevating, 24 placing elastic hose. What is our problem with the reduction in the deep tendon reflexes? What's our biggest issue? Safety. Doesn't, elevating them isn't going to help. That's going to be if you've got issues with venous stasis. But this patient is going to have trouble with ambulation and balance, so safety is going to be their issue. The nurse implements which action in assessing circulation of the client's extremity following cerebral angiography? Checks pulses distal to the injection site, measures orthostatic blood pressure, performs fundoscopic examination, monitors skin turgor. %, said check the distal pulses. Very good. Orthostatic blood pressure, we really don't care about that at this point. We need to make sure that they have good circulation to the extremities. Which of the following instructions or precautions should the nurse teach the client who's scheduled for a PET scan, a positron emission tomography scan of the brain? Avoid caffeine for 12 hours before the test. Drink at least 3 liters of fluid during the 24 hours before the test. Avoid bathing and washing your hair for 24 hours before the test. Remove your dentures before the test begins. So 71% said avoid caffeine, 24% said remove your dentures. What is it about the PET scan? What does it test? Brain metabolism. So anything that's going to affect the metabolic activity of the brain needs to be avoided. So no stimulants, no alcohol, food, things like that. The client with epilepsy develops stiffening of the muscles of the arms and legs, followed by an immediate loss of consciousness and jerking of all extremities. How will you document this seizure activity? Generalized atonic, generalized absence, generalized myoclonic, generalized tonic-clonic. And that would be your generalized tonic-clonic seizure, your grand mal. In providing discharge teaching to a client after a lumbar laminectomy, the nurse instructs the client to return to the hospital for which potential complication? Pain at the incision site, decreased appetite, slight redness and itching at the incision site, clear drainage from the incision site. %, clear drainage, because what does that indicate? A CSF leak. The client who suffered a spinal cord injury at level T5 several months ago develops a flushed face and blurred vision. On taking the vital signs, the nurse notes the blood pressure to be 184/95. What is the nurse's first action? Palpate the area over the bladder for distension. Place the client in Trendelenburg, administer oxygen, perform carotid massage. So palpate the bladder for distension. 15% said oxygen. So what is this describing? What condition? Autonomic dysreflexia. So one of the causes is bladder distension. What are some of the other causes? Impaction or tight clothing. Which symptoms experienced by a client with a spinal cord injury at T5 level would alert the nurse to the presence of a complication of this injury? Rhinorrhea, fever and cough, anxiety and restlessness, pain radiating from the hip to the knee. love this too. Okay, 32, rhinorrhea, 11, fever and cough, 21, anxiety and restlessness, 37% said pain radiating from the hip to the knee. Well, first of all, what does T5 indicate? Thoracic. Where's the thoracic vertebrae? The thorax. So it's the upper body, right? Chest. So if we have problems at the T5 level, at the chest level, are we going to have pain radiating from the hip to the knee? No. Are we going to have rhinorrhea? No, because we don't have a head injury. We don't have anything going on upstairs here. So now we're down to fever and cough and anxiety and restlessness. Why anxiety and restlessness? Well, cervical, you're having problems with respiratory muscle, but you're still going to have some issues with your lungs, right? So anxiety and restlessness isn't going to be as big a problem. It's not going to be an indication of a problem as much as fever and cough. Because what is fever and cough going to tell you? Infection, pneumonia. So they're having their muscles are weakened, but they're still functional. Unlike a patient with a C-spine injury whose respiratory muscles won't be functional and they're going to need a ventilator. So the anxiety and restlessness will be indications of hypoxia. But this patient is going to be at more risk for developing pneumonia because of his poor respiratory function, hygiene. That's why that's not on the test. The nurse correlates which clinical manifestation of Guillain-Barré syndrome as the most common: ophthalmoplegia and diplopia, progressive weakness without sensory involvement, progressive ascending weakness and paresthesia, weakness of the face, jaw, and sternocleidomastoid muscles. %, ascending paralysis. Very good. Okay, the client with myasthenia gravis in cholinergic crisis has been treated with atropine. Which nursing intervention is a priority? Suctioning, turning and repositioning, measuring urinary output every 30 minutes, administering anticholinergic drugs on time.
Oh no.
64% said suctioning, 27% urinary output, 9% said administering cholinergic drugs on time. Okay, patient has too much of the cholinergic drug, so they have a lot of secretions, right? And now we're treating them with atropine. What is our priority? Suctioning, airway, ABCs. Urinary output, I don't really care about it. I want to make sure he's breathing and doesn't get a mucus plug, so we have to, disconnect him from the ventilator and start bagging him. And the drugs are not part of your issue. Okay, client with aphasia presents to the emergency room with a suspected stroke. Which assessment data would lead the nurse to suspect that this client has had a thrombotic or ischemic stroke? 2 episodes of speech difficulties in the last month, a sudden loss of motor coordination, recent seizure activity, nuchal rigidity. %, 2 episodes of speech difficulties, 38% sudden loss of motor coordination. Okay, so tell me why you picked them.
Number 1, it's a gradual change versus hemorrhagic, which is sudden.
Right. So there's two of the differences between the 2 types of stroke. Oftentimes, patients with ischemic or thrombotic strokes have had TIAs, or other types of episodes of speech problems. So that means that it's kind of almost an evolving or episodic type of situation. Whereas a sudden loss of motor coordination is one of the signs that you would see in a patient with a hemorrhagic stroke who just, you know, bursts an aneurysm and boom, they're immediately, you know, they pass out, they're not coordinated, they lose a lot of neurological function very quickly.
Do you also think that the 2 episodes may have been like TIA?
Absolutely, absolutely. Because the thrombotic or ischemic stroke, that's very common with those patients to have a TIA as they're, you know, shooting off little tiny clots. So with my mother, it was because of her mitral valve issue, and she was, you know, tossing the clots, and that's why they wanted to do the valve replacement. The client admitted to the ICU with a stroke becomes lethargic and unable to articulate words when speaking. Which is the nurse's best action? Document the finding and check BP as the only actions. Elevate the head of the bed 30 degrees and call the doctor. Place the client supine and monitor. Assess WBCs and differential. So 90% said elevate the head of the bed. Why? But what is the pathophysiologic rationale for that? It's going to decrease edema. It's going to promote venous and CSF return, because what are those signs telling you? The intracranial pressure is increasing. They're deteriorating neurologically. They're changing from their baseline. Placing them supine is going to do what? Yeah, that's just going to pull. They're not going to get any drainage of the CSF and the fluid. The client who first experienced symptoms related to a confirmed thrombotic stroke 2 hours ago is brought to the ICU. Which would you prepare to administer? TPA, heparin, Neurontin, or Coumadin? Okay, 28% said TPA and 72% said heparin. Okay, what are the key words in this question? Thrombotic stroke, and what else? 2 hours ago. So what are we going to give? TPA first, thrombolytics first, because it's within 6 to 8 hours of the onset of symptoms. So thrombolytics first, then heparin later. So that's what you're going to be giving. You're going to anticipate giving thrombolytics if they only started having symptoms 2 hours ago. The client's receiving Coumadin after a thrombotic stroke. Which international normalized ratio indicates anticoagulation is adequate? 0.5 to 1, 2 to 3, 5 times control, same as control. Yeah, this one's a gimme, that's why it's not on your exam. Aww. Yeah, 100%. Wow, you guys are bad.